There's a huge demand, especially as the valley gets bigger, and the valley's only going to get bigger. So my name's Jeff Rogers, and I am the EMS instructor for the college. I'm also a wildland instructor for them. The program itself is the basic EMT. That's kind of your stepping stone into the EMS world. Basically what you're learning is everything from this is an ambulance all the way up to how to treat a cardiac arrest.
It's a very difficult class, but it's very enjoyable. You learn so much, and I mean, it does seem a little bit amount of time, but you learn so much to help you progress to be that EMT that's going to help people when they need you right then and there.
We're about halfway through the class. We're not into like the medical and trauma stuff. The best thing is we've worked on airway a lot, so they're teaching us how to ventilate patients and put in like a nasal adjunct or an oral adjunct, that kind of stuff. And you gotta be able to know to put those things in properly so you don't injure somebody.
Most of it's lecture, but we do our skills, which is hands-on. We've done oxygen administration via non-rebreather and BVM. I enjoy the relaxed atmosphere most of all, and the hands-on and the ride-alongs on the ambulance, getting to see how everybody does things differently.
At the end of this program, they get a certificate of National Registry. National Registry is what you need to move from state to state. So at the end of it, when they go and take their National Registry exam and pass it, then they'll actually get that, and then they can go into their individual states and get their state license.
Most of the full-time agencies in the country, you have to be at least an EMT basic to work there. So what this does is it starts you out, and in most places you have to have at least your basic EMT before you can go up to your advanced, to your intermediate, or your paramedic. So this is where you start.
I actually work at the St. Al's ER as a CNA. I know quite a few people through Treasure Valley paramedics that really enjoy their job, and it kind of made me get an idea, a little itch that I wanted to maybe pursue this and see if there's a different side of it, or seeing the different side of it coming in from the ER, or from outside coming into the ER. So
the biggest opportunity that opens up for them is after they get this, they can actually go work on an ambulance, as long as there's an opening in that ambulance agency. What a lot of people are doing it for is to get into the fire service. In order to get into the fire service, you have to have your EMT basic. That's what pretty much every fire department in the area is looking for.
While being on rural fire, we deal with a lot of MVA, motor vehicle accidents. And in rural fire also out there, we don't have a lot of medics or EMTs available if we're out, and I want to be able to help our guys.
So being in this EMT class is really different from the ER, because in the ER you see the aspect of what EMS is already bringing you. You have certain stuff done to the patient, and when I've done a few ride-alongs and I've actually really enjoyed them, because that gives you a different perspective of what's going on.
So the best part about being an EMT is getting to help people. So you're going to these people that are having the worst day of their life, and you may be able to change that, help them, save their life. As
working in the ER currently, with the EMT class, I can become more than just a CNA. I can become an ER technician, and that gives me more privileges to be able to do in the ER, and helps me a little more interaction with the patient and have more a bigger job scope to do. And then it kind of just gives me an idea if I want to continue and be a paramedic, if that comes in the near future.
Being an EMT is a good start for your career in emergency services.